us. A lot of women face this issue, but जिसके बारे में ज़्यादा बात नहीं होती. So here we are. We are here to talk about
PCOS is a
PCOS.
very common issue. Just in women in reproductive age group, which is what we consider 20 to 45 years of age. About 1 in 5 women in India are diagnosed to have PCOS. Considering it's a sugar and hormone issue, like insulin issue, तो it is very likely कि आगे जाके आपको sugar होगा. इट इज वेरी लाइकली कि आगे जाके आपको कोलेस्ट्रॉल का इश्यू होगा. इट्स वेरी लाइकली कि आगे जाके आपको हार्ट अटैक, स्ट्रोक्स, इन सारों का रिस्क इंक्रीज होता है क्योंकि आपका बॉडी शुगर अच्छे से प्रोसेस नहीं कर पा रहा है. दैट इज द बेसिक थिंग कि जैसा दूसरों का बॉडी शुगर को अच्छे से प्रोसेस कर पा रहा है, हमारा बॉडी नहीं कर पा रहा है, बिकॉज आई ऑल्सो हैव पीसीओएस, राइट? सो but those are not things that are talked about at all. Like it's on a nazariya of taking care of yourself,
Yeah.
which is from where I want you to start your PCOS management. On to your first
journey.
question, which are actionable steps, and these are really interesting but small things you can do. And the first thing is
You shifted the entire narrative, from, the narrative is always blaming women that it is you are not doing enough, and never from the perspective of that you need to take care of yourself. So, hello everyone. We are back again with our podcast, our We the Women podcast, and today we have a very special guest with us. We have Dr. Christianez, who is here with us. She has been, a supporter, a cheerleader for We the Women for quite some time now, and we have been following her writings for some time, and she writes for Behan Box and some other organizations as well. Her writing is amazing. You should definitely check her writings out. Today we are here to discuss a very particular issue with her. Today we are here to discuss an issue जो शायद हर महिला फेस करती है, more or less. A lot of women face this issue, but जिसके बारे में ज़्यादा बात नहीं होती. So here we are here to talk about PCOS. So now I just wanted to request Dr. Christianez to first of all tell us a little bit about what is PCOS and how can women know that they have PCOS.
Hi, Janvi. Thank you so much for inviting me here. And thank you so much for deciding to address such an important topic. जैसे आप बोला है, PCOS is a very common issue. Just in women in reproductive age group, which is what we consider 20 to 45 years of age. About 1 in 5 women in India are diagnosed to have PCOS. And this is so much higher than the global average. Global average is about maybe 10% of women, and or even lesser than that. So India may about 1 in 5 women are found to have PCOS. Now PCOS के बारे में जब हम बात करें तो very commonly आपको weight gain के बारे में you would have heard. So more often than not, PCOS in India is discussed in the context of weight gain. But PCOS as a disease is so much more than that. अगर मैं simple way में बताऊं तो PCOS is the sugar in your ovaries. Okay? तो PCOS is जो है वो एक हार्मोन इश्यू है. ओके एंड उसके वजह से क्या होता है, हार्मोन इश्यू के वजह से शुगर डिपॉजिट होता है. तो जहां हमारा बॉडी में ब्लड शुगर ज्यादा है और हमारा बॉडी में शुगर हमारे बॉडी टिश्यूज में ज्यादा है, अगर ऐसा ही ओवरी में शुगर ज्यादा है, उसको हम पीसीओएस बोलते हैं. तो दैट इज अ सिंपल वे ऑफ एक्सप्लेनिंग. अगर साइंटिफिकली आप देखो तो ये शुगर इसलिए ज्यादा है क्योंकि हमारा बॉडी इंसुलिन रेसिस्टेंस करके एक फीचर एक्वायर कर लेता है, जिससे क्या होता है कि व्हेन यू ईट फूड, तो आप जब फूड खाते हैं तो डाइजेस्ट होके वो ग्लूकोज बनता है, एंड ये ग्लूकोज हमारा एनर्जी के लिए हमारे टिश्यूज अपटेक करते हैं और यूज करते हैं, राइट। तो वो अगर हमारे टिश्यूज ये ग्लूकोज यूज करने के लिए दे नीड अ हार्मोन कॉल्ड इंसुलिन, ठीक है।
Okay.
और
Hmm.
वो इंसुलिन जब हमारे बॉडी में सेक्रीट होता है, वो इंसुलिन जाके हमारे टिश्यूज को क्या करता है, वो सेंसिटाइज करता है ताकि वो टिश्यूज ब्लड से ग्लूकोज ले और उसको यूज कर पाए, राइट।
Hmm.
सो
Hmm.
फॉर दैट रीजन वी नीड इंसुलिन। नाउ इंसुलिन रेसिस्टेंस क्या होता है कि हमारे टिश्यूज में एक ऐसा चेंज आता है जिससे इवन इफ बॉडी में इंसुलिन है तो वो इंसुलिन को पहचान नहीं पाता है, तो वो ऐसा एक्ट करता है जैसा बॉडी में इंसुलिन नहीं है, ठीक है। तो जो ग्लूकोज को वो लेके यूज करते हैं हमारा मसल्स फॉर एनर्जी, वो ग्लूकोज आपका ब्लड में ही रह जाता है और वो जाके दूसरा टिश्यू में डिपॉजिट होके उसमें प्रॉब्लम्स क्रिएट करता है, ठीक है। एंड दिस पॉइंट इज इम्पोर्टेंट बिकॉज पीसीओएस का ट्रीटमेंट, पीसीओएस के कॉम्प्लिकेशंस, ये सब के बाद जब हम करेंगे आगे जाके, तो हम ये इंसुलिन रेसिस्टेंस के अराउंड ही सबको हिंज करेंगे, विच इज वाई दो ये साइंस हैवी है, मैं ये स्टार्टिंग में ही बता दे रही हूँ, राइट।
Hmm.
तो
Hmm.
पीसीओएस जो है, इट्स अ हार्मोन रिलेटेड बीमारी। इसका बेसलाइन इश्यू इसलिए होता है कि इंसुलिन रेसिस्टेंस से होता है। तो उसके वजह से दो चीज होता है, एक जैसे हम बोला, आपका मसल शुगर को उठा नहीं पाते हैं टू यूज, तो शुगर ब्लड में ही रह जाता है। और सेकेंड
Hmm.
चीज ये है कि तुम्हारा बॉडी को लगता है कि इंसुलिन नहीं है तो इंसुलिन ज्यादा प्रोड्यूस करेंगे हम उसको, लाइक बिकॉज तुम्हारा मसल को लगता है इंसुलिन नहीं है, सो तुम्हारा पैनक्रियास और इंसुलिन प्रोड्यूस करने लगता है,
Hmm.
ठीक है। तो देर आर टू थिंग्स जो अभी आपका बॉडी में ज्यादा है, जो कि ग्लूकोज भी है जो यूज नहीं हो रहा है एज एनर्जी, एंड सेकेंड थिंग इंसुलिन भी है विच इज नॉट बीइंग यूज्ड फॉर इट्स ओन पर्पस। नाउ ये दो चीज जब इतना ज्यादा है तो उस वजह से लॉट्स ऑफ इश्यूज कैन हैपन। वन ऑफ दैट इज वेट गेन। तो वेट गेन में क्या होता है, पीसीओएस में आपका बॉडी में फैट डिपोजिशन ज्यादा होता है, क्योंकि जो ग्लूकोज आपका मसल यूज नहीं कर पा रहा है वो फैट बन के रह जाता है। सेकेंड थिंग इज, इतना इंसुलिन होने से ये इंसुलिन दूसरा हॉर्मोन्स को थोड़ा मेसअप करता है, ठीक है। उस वजह से आपका टेस्टोस्टेरोन, जो कि मर्दों में ज्यादा होना चाहिए और औरतों में थोड़ा कम लेवल में होना चाहिए, वो बढ़ जाता है। और ये टेस्टोस्टेरोन का होने के वजह से आपका बाल झड़ता है और आपका एक्ने आता है, पिंपल्स, राइट। तो आपका स्किन इश्यू, हेयर इश्यू, ये सब आता है। और हिरसुटिज्म बोलते हैं, जिससे बेड और मुस्टैच जैसा बॉडी हेयर का एक्सेस आ जाता है। नाउ थर्ड थिंग, कॉर्टिसोल विच इज स्ट्रेस हार्मोन, ये भी पीसीओएस में बढ़ जाता है। तो स्ट्रेस हार्मोन बढ़ने के वजह से अगेन वेट गेन होता है और फिर बॉडी में वाटर रिटेंशन होके ब्लोटिंग फील करते हैं, ठीक है। एंड अलोंग विद दैट स्ट्रेस भी होता है, स्लीपलेसनेस, ये सब होता है। एंड
Hmm.
ऑन टॉप ऑफ ऑल दिस क्या होता है, क्योंकि हम बोला कि ये शुगर जो है कॉन्सेंट्रेशन ओवरी में भी बढ़ता है, तो ये आपका रिप्रोडक्टिव फंक्शन को थोड़ा मेसअप करता है, राइट। तो ओव्यूलेशन, जो कि आपका ओवरी से जो अंडा निकलता है महीना महीना, वो उसको रोक देता है, ओके।
Hmm.
सो उसमें क्या होता है, आपका मेंस्ट्रुअल साइकिल्स नॉर्मली नहीं चलता है और महीना महीना जो आपका पीरियड आना चाहिए वो नहीं आता है। और दूसरा बात है कि जब अंडा नहीं निकल रहा है हर महीना, तो आप अगर प्रेग्नेंट होने के लिए ट्राई कर रहे हैं, हम गारंटी नहीं दे सकते हैं कि कौन सा महीने निकलेगा कौन सा महीना नहीं निकलेगा, तो आपका फर्टिलिटी के हिसाब से भी थोड़ा इश्यू आ सकता है, ओके। सो पीसीओएस अगेन, एक तो वेट गेन से जाना जाता है, दूसरा तो फर्टिलिटी क्लिनिक्स में ज्यादा पाया जाता है, व्हेन अ वुमन वुड गो टू अ डॉक्टर एंड से कि आई एम ट्राइंग टू गेट प्रेग्नेंट बट नहीं हो रहा है, तो उस कॉन्टेक्स्ट में पीपल डू फाइंड। बट द इश्यू इज कि एज आई हैव सेड, जैसे मैं आपसे बात कर रही हूँ आपको समझ में आ रहा होगा कि स्किन को अफेक्ट करता है, हेयर फॉल अफेक्ट करता है, स्ट्रेस कॉज करता है, स्लीप अफेक्ट करता है, वेट बढ़ा देता है, एंड ग्लूकोज को मतलब आपका ब्लड स्ट्रीम में ही छोड़ के इफ इट इज नॉट गोइंग इनटू योर मसल्स ऑब्वियसली आपका एनर्जी भी अफेक्ट होता है। एंड कुछ कुछ स्टडीज ये भी दिखा रहे हैं कि पीसीओएस का कुछ मेंटल हेल्थ के साथ भी इश्यूज कॉज कर सकता है, जैसे डिप्रेशन एंड एंजाइटी एंड पीसीओएस का एसोसिएशन है। तो पीसीओएस एज अ थिंग ये आपका एंटायर लाइफ को एकदम से डिरेल कर सकता है। एंड आपका क्या क्लस्टर ऑफ सिम्टम्स होगा, इनमें क्या क्या सिम्टम्स आपको होगा, क्या क्या नहीं होगा, वो हर एक इंडिविजुअल के ऊपर डिपेंड करता है, राइट? सो
Hmm.
it is very important to identify and address PCOS because it affects every single aspect of your life and your health and your body. तो ये आपका पूरा वेल बीइंग को मतलब it can affect. So we really need to identify and treat it outside of the fertility and outside of the looks aspect. Like
Yeah.
if you see the people who identify PCOS mostly are dermatologists because these people are going to them saying I'm not looking good enough,
Yeah.
or it's fertility specialist.
So as you said, ki PCOS is not just affecting your looks. Ki, you are having hair fall. Some women might also have some facial hair growth, and so there's that aspect, and there's the fertility aspect. But then there's also this aspect ke it is adversely affecting your physical health and mental health as well. Also, I wanted to ask, you have written in your article, so I also have PCOS, and when you go to the doctor, their concern is that fertility will be an issue going ahead, and that you are gaining weight and the looks and everything like that. But you have mentioned a very crucial thing in your article, that if you don't get period, at least 4 times a year, the chances of getting endocrinal cancer, if I'm not wrong,
Endometrial cancer.
endometrial cancer are also increased.
Yes.
Yes.
So let me just explain that a little bit. जब
Hmm.
आपको ओव्यूलेटरी साइकिल ऐसे जब आपका अंडा निकलता है हर महीना, उसका 15 डेज के बाद आपका एंडोमेट्रियल लाइनिंग जो कि यूट्रस का लाइनिंग होता है वो शेड होके मेंस्ट्रुएशन होता है, मेंस्ट्रुअल ब्लड। हाँ, अगर आपका 4 टाइम्स ये नहीं हुआ इसका मतलब ये है कि आपका एंडोमेट्रियल लाइनिंग बहुत थिक हो जाता है, और जब वो बहुत थिक हो जाता है तो उस सेल्स में चेंजेस आने का चांस है जो उसको कैंसर बना सकता है। तो ये एंडोमेट्रियल लाइनिंग इज द लाइनिंग इन साइड ऑफ द यूट्रस जो हर महीना शेड होना चाहिए, एंड दैट इज व्हाट गेट्स शेड एज मेंस्ट्रुअल ब्लड। एंड इफ दैट डजंट हैपन एटलीस्ट 4 टाइम्स इन अ ईयर, देन वो अक्यूमुलेट होके वहां पे जहां रहता है, it can lead to it becoming cancer. So this is something that nobody really tells women with PCOS, like, but it's so important. Like, मैं बच्चा
Hmm.
बनाऊं नहीं बनाऊं, मुझे कैंसर नहीं होना चाहिए, राइट? दैट इज
Exactly.
लाइक मेरे वेल बीइंग के लिए वो इम्पोर्टेंट है, डिस्पाइट कंसिडरिंग एनीथिंग अबाउट अ हाइपोथेटिकल बच्चा एग्जिस्टिंग और नॉट। एंड द सेकेंड थिंग जो मैं आर्टिकल में मेंशन किया है एंड आई वांट टू पॉइंट आउट इज, अगर आपको पीसीओएस है, especially considering it's a sugar and hormone issue like insulin issue, तो it is very likely कि आगे जाके आपको शुगर होगा, इट इज वेरी लाइकली कि आगे जाके आपको कोलेस्ट्रॉल का इश्यू होगा, इट्स वेरी लाइकली कि आगे जाके आपको हार्ट अटैक, स्ट्रोक्स, इन सारों का रिस्क इंक्रीज होता है क्योंकि आपका बॉडी शुगर अच्छे से प्रोसेस नहीं कर पा रहा है। दैट इज द बेसिक थिंग कि जैसा दूसरों का बॉडी शुगर को अच्छे से प्रोसेस कर पा रहा है, हमारा बॉडीज नहीं कर पा रहे, बिकॉज आई ऑल्सो हैव पीसीओएस, राइट? सो but those are not things that are talked about at all. Like especially जबकि मैं अपना पीसीओएस कंसल्टेशंस में जब गई and I was told कि lose weight, right? That was the first thing I was told. And it's not wrong to tell somebody to lose weight, because actually इट्स अ नोन थिंग कि जितना आपका बॉडी में फैट है उतना वो और मेसअप कराता है आपका इंसुलिन को. आप पहले वेट गेन पीसीओएस के वजह से करते हो, क्योंकि वो शुगर को मेसअप किया है. बट जो वेट गेन आप किया है वो वेट और उस चीज को मेसअप करता है, राइट? सो
It's
ये
a
एक
toxic
ऐसा एक
cycle.
विशुअल साइकिल बन जाता है. तो अगर आप वेट गेन को रोक सकते हो और उसको रिवर्स कर सकते हो, आपका सिम्टम्स काफी हद तक ठीक होगा. दैट इज नॉट रॉन्ग एट ऑल टू एडवाइस समवन. बट फिर बोलो तो कि मैं वेट कैसे लूज करूं, बिकॉज एक हेल्दी तरह होता है, एक अनहेल्दी तरीका होता है. एंड इफ यू सी normal people without these messed up hormones, the way they can lose weight is completely different from the way a PCOS person can lose weight, right? For example, एक normal person को अगर आप बोलो कि आप I'm just saying normal in the context of PCOS and non-PCOS.
Hmm.
Um, okay,
Hmm.
so if you say somebody with a normal metabolism to lose weight, all they have to do is cut out a few things from their diet on an everyday basis, and more often than not, they will be able to lose that weight. But that is
Hmm.
not the case for somebody like me, whose hormones will then work extra hard against me to ensure कि जो I'm not losing weight, right? Like in that sense, my body is not cooperating with me, right? So I have a, like, I need to be told कि exactly क्या करना है और कैसे करना है. You have to give me an actionable plan, and that is somewhere very missing in terms of these uh, doctors in India, especially. I don't every single gynec or every single endocrinologist I went to, they just talk to you as though you have not as though you are lazy. But
Hmm.
the time that I had gone to them, I had already started working out every day. Like it was like 6 days a week I'm exercising, and I'm severely cutting down on like all kinds of takeout. I'm not eating this or that. But you know, they're not able to say ki, then after that, why am I not losing weight? Which if you see any PCOS Reddit forum or anywhere, there will be people who are asking these questions कि मैं इतना तो कर रही हूँ, मैं वेट क्यों नहीं लूज कर रही हूँ. एंड कोई तो जवाब नहीं देता है हमको.
And
तो
it's a,
दैट
I,
इज.
yeah, I
प्लीज गो
just
अहेड.
wanted to say this thing कि it's a national scale का gaslighting. You pointed out how this can derail a person's life completely, and so many women are suffering from this, and yet there's no conversation about this. Is a health hazard, and nobody is talking about it. And the women that are going to the doctors बस यही बोलते हैं वेट लॉस करो, वेट लॉस करो, वेट लॉस करो. एंड इट्स जस्ट रिडिकुलस. दे आर नॉट एक्सप्लेनिंग टू देम कि हो क्या रहा है उनके साथ. So for me, when I read your article, for the first time I understood what is happening with my body.
Sad, right? कि like um, so my experience was that I did eventually lose 10 kgs of weight, and then I went back to that same doctor, and you know what she said after that? She said weight loss karo. My husband had accompanied me on this consultation, and he was so shocked. He was going to shout at her कि और कितना weight lose करेगी ये, मतलब क्या बोल रहे हो आप, right? And then in
Hmm.
that consultation, we had not brought up fertility as a thing at all because it was not a concern for us. And as a couple, we had decided that babies are not in the picture for us at all. But we were told immediately that you should have a baby as soon as possible when she's getting her periods रेगुलरली नाउ. अदरवाइज आगे जाके बहुत इश्यू होगा, आईवीएफ करना पड़ेगा, ये करना पड़ेगा, वो करना पड़ेगा. एंड देन वी वर जस्ट लुकिंग एट ईच अदर लाइक कि ये फियर मॉन्गरिंग क्यों कर रहे हो,
Hmm.
राइट? एंड when we are not focusing on fertility, the fact that you are bringing it up that's a little bit of a like I felt like as a woman, it reduced my value to being a childbearing
Hmm.
individual rather than what PCOS was doing to me. Because trust me, I had mental health issues, I had loss of energy, I had fatigue, I had sleeplessness, I had all these things, right? And there is also this fear of growing older and having diabetes, developing other complications. So there are these real, very real things that I'm struggling with, and here you are making me worry about something that I'm not already worried about, right? Like फर्टिलिटी अगर
Hmm.
मेरे लिए ही फोकस नहीं है तो आप क्यों फियर मंगर कर रहे हो? और
Yeah.
एक और चीज है, ये लोग PCOS के साथ associate करते हैं the word infertility, but that is not the case. What is associated with PCOS is subfertility. You are a little lesser fertile than the average
Hmm.
female, but you're not infertile. And the use of that word with association with this condition is a little bit of a problem. I feel like it's made it sound like anybody with PCOS will have a lot of struggles having children going forward, and that's not necessarily true. And you get it, the whole the picture of PCOS is painted with the light of infertility and not looking good, which is like it's not serving the woman as an individual, it's serving
Hmm.
the society and the way it wants to view this woman as an object that looks good and as an object that can produce children. So ये नजरिया में ही कुछ प्रॉब्लम है.
Yeah. I'm so grateful कि you are here today and we are talking about this from this perspective कि as an individual women कितनी दिक्कतें face करती हैं from PCOS, apart from the facial hair and the hair loss and just the reproductive and the physical looking wala aspect of it. I also wanted to ask you कि you talk about how, since you are a medical professional, since you are a doctor, you know how to read the PCOS research for yourself, and talk about it. So since these doctors are not talking about it, is there a lack of PCOS research in our country?
That's a very nice question, and it's so surprising because nobody is talking about PCOS that much. तो आपको लगेगा कि
Hmm.
research नहीं हो रहा है, but it's one of the most hot topics that is researched in the country. Okay, अगर आप कोई research website खोलोगे, इंडिया में ही इतने सारे articles हैं about PCOS and इतने सारे very valid scientific studies है, but इसको कोई क्यों नहीं बैठ के पढ़ रहा है? इससे कोई एक अच्छे गाइडलाइंस क्यों नहीं बना रहे, ये मुझे समझ में नहीं आ रहा है. बिकॉज इफ फॉर एग्जाम्पल कन्वेंशनल थेरेपीज तो है ही. एक तो देर इज दिस बर्थ कंट्रोल पिल्स जो वो देते हैं आपका पीरियड्स को रेगुलराइज करने के लिए. वो आपका मतलब इट इज लाइक अ बैंडेड सोल्यूशन. वो आपका पीरियड्स तो रेगुलराइज कर देगा, बट जो इंसुलिन का इश्यू जिस विच इज द पीस ऑफ द पजल दैट इज द मोस्ट इम्पोर्टेंट, उसके साथ तो वो कुछ नहीं करने वाला है. ठीक है, सो इफ यू हैव PCOS एंड यू आर
Hmm.
जस्ट गेटिंग ट्रीटेड बाय बर्थ कंट्रोल, दिस इज अ बैंड एड ट्रीटमेंट. तो अगर वो इंसुलिन का इश्यू की बात करें, देर इज दिस थिंग कॉल्ड मेटफॉर्मिन. मेटफॉर्मिन इज अ ड्रग दैट इज यूज टू ट्रीट डायबिटिक्स. वो क्या करता है कि इट अलाउज योर मसल्स टू टेक इन द इंसुलिन दैट इट वाज प्रीवियसली रिजेक्टिंग. तो
Hmm.
आपका मसल वो इंसुलिन सेंसिटिव हो जाएगा और वो इंसुलिन के हेल्प से वो ग्लूकोज को उठा पाएगा और यूज कर पाएगा. मेटफॉर्मिन इज अ ब्यूटीफुल ड्रग. ओके, वो बहुत चीप भी है और वो डायबिटीज के लिए बहुत यूजफुल भी है, राइट? बट एंड PCOS के लिए भी इट इज क्वाइट यूजफुल. बट द थिंग इज दैट these are not the only options. Like there will be people who will say कि मुझे ड्रग्स नहीं चाहिए, तो मैं क्या
Hmm.
करूं? तो आपको
Hmm.
देर आर थिंग्स लाइक कि अगर आप डाइट अच्छा से मेंटेन करो, एक्सरसाइज करो, तो दोस itself will be as good as metformin in dealing with this sugar imbalance. But nobody is going to teach you. Like कि क्या खाना है क्या नहीं खाना है. And one of the most problematic things is they'll say diet करो, right? And there are 2000 types of diet. तो diet का क्या मतलब? So
Hmm.
there is this diet called Mediterranean diet, जिसमें they focus more on good fats and including vegetables. Then there is
Hmm.
the keto diet, right? जहाँ पे आप पूरा carbs eliminate कर लेते हो. Hmm. Then there is this whole food plant based diet जहाँ पे आप सारा animal products eliminate करके जितना भी plant खा सकते हो वो सब खाते हो. तो कोई आपको ये नहीं बता रहा है कि डाइट करो बोलने का मतलब क्या है, कौन सा डाइट,
Hmm.
राइट? एंड एक्सरसाइज करो बोल देते हैं बट दे आर नॉट टेलिंग यू कि कौन सा एक्सरसाइज करो. एंड अगर
Hmm.
मैं मेटफॉर्मिन या अगर मैं बर्थ कंट्रोल नहीं चाहती हूँ, मुझे नहीं चाहिए फार्माकोलॉजिकल एजेंट्स, मुझे चाहिए सम फॉर्म ऑफ लाइक न्यूट्रिशनल ट्रीटमेंट जैसे विटामिन, ये सब से अगर मैं क्या कंट्रोल कर पाऊंगी. एंड देर आर नो आंसर्स. Actually, there are a lot of research based answers, but there are no answers coming from doctors.
Hmm.
And that is the issue, right? So, research तो बहुत है in India, but people are not aware of it and people are not actually talking about it to their patients. And the second thing is that Indian medical system follows a very paternalistic approach. इसका मतलब ये है कि डॉक्टर समझता है दैट आई एम द वन विथ ऑल द नॉलेज एंड ऑल द डिसीजन मेकिंग पावर. मैं तुम्हारे लिए एक प्रिस्क्रिप्शन लिखूंगी एंड दैट तुमको बिना किसी क्वेश्चन के बिना किसी कोलैबोरेशन के फॉलो करना पड़ेगा. नाउ
Hmm.
मेरी फ्रेंड का स्टोरी है. शी हैड गॉन टू अ डॉक्टर एन एंडोक्रिनोलॉजिस्ट फॉर पीसीओएस. शी हैड बीन रिटन दीज medications and sent out within 10-15 minutes of talking, right? She had a more emotional episode, I guess, when she explained her symptoms. And I think she cried also, like with her what she told me to the doctor. And after she comes out and Googles her medication, she finds out that this person has added an antidepressant without telling her. He has added metformin, which is the diabetes ka treatment, which is also PCOS ka treatment, but she needs to be explained what is being added, right? So she Googled what it was, she got shocked, and then she wanted to go back in to speak to the doctor. And the people in the consultation area were like, no, no, he doesn't talk to people after their consultation gets over. She had to beg and go inside and ask for explanation, and the doctor didn't explain. So now,
Hmm.
if for example, I am a doctor, I am a physician, I will be able to understand the prescription and ask relevant questions inside the consultation room, right? But people who are not physicians, people who don't have that knowledge, do they not deserve an explanation as to what is being written for them? And if at
Hmm.
all they are not okay with it, then it's the doctor's job to either explain to them exactly what it is so that they will get convinced, or collaborate with them to come up with a different option. Ki, okay,
Hmm.
if you say this is not good for you, then we will talk about other options. But that's not the way Indian consultations work, right? And
Hmm.
that is also something that I feel, especially if the patient is a woman, this is going to happen more often. एक लड़का को somebody might even respect enough to sort of explain when they ask questions, but they do tend to look down upon women, especially as like consumers of things. So even if it's about your own body, your questions are quite likely to get dismissed by doctors. So ek to they are not giving you good information, secondly they are not prioritizing the condition enough to read up the research that is already there, and thirdly
Hmm.
they are telling you that they're going to give you things and they're not giving you an opportunity to ask questions, and they're not giving you an opportunity to be a active participant in your own care. And on top of this, what will happen is that every single person who goes to multiple doctors, which will happen in this case, right? अगर आपको कोई अच्छा information नहीं दे रहा है, तो फिर आप दूसरा opinion क्यों नहीं seek करोगे,
Hmm.
right?
Hmm.
So there is a study from PGI Chandigarh which says that women had to go to at least 2-3 doctors until they were able to hear some form of information about PCOS, right? तो अगर आप तीन चार डॉक्टर्स के पास जा रहे हो and each of them is giving you some contradicting information, conflicting
Hmm.
information, then you will develop this thing called trust deficit, in which you are like not believing in the medical profession itself because हर कोई कुछ ना कुछ दूसरा बोल रहा है ना? तो इस चीज के लिए हमको क्या चाहिए, एक यूनिफाइंग गाइडलाइन चाहिए, जहाँ पे बहुत all the academic bodies in India, there is a PCOS society. It has a guideline, but it's focused a lot on medication. But shouldn't they speak to other endocrinologists, dietitians, physical therapists, trainers, personal trainers, all of them, and come up with what you think is the best diet advice? What do you think is the best exercise prescription to be given? And then make it uniform so that everybody who's treating people with PCOS will have like the same knowledge. And then patients are not coming out of each consultation conflicted about, what you're saying.
Yeah, this is actually a very important suggestion, a recommendation that there should be a demand around it. Okay, there has to be a standardized guideline of this. If so many of your citizens are suffering from a particular disease, and I also wanted to ask, you talked about how the questions of women, you know, overall the question of patients don't get taken seriously, but especially coming from women. I also wanted to ask, does that also happen if a woman is complaining about something, then they would not take it as seriously? If a woman is explaining I'm having XYZ issue, then they would just give a blanket solution कि नहीं ये दवाई खा लो या वजन कम करो या कुछ भी, anything of that sort, या फिर कि ये तो होता है, it's not a big deal. So does that
Yes,
also happen?
yes, that happens a lot. Actually, this is a known secret in the medical field, and um, this is a good place for me to mention that even as a doctor, it's not easy for me to get healthcare, and it's not easy for me to go sit in that consultation room and be taken seriously, even though I'm a physician and I hold so much societal clout as a physician, right? Like, I'm one of the most privileged people in India, I would say, as a woman, even. And even I get anxiety before I go to my sessions. Even I have to write down my concerns, and even I have to um, sometimes take my husband, and that feels very what do you call it, humiliating, that
Hmm.
such an empowered woman, I have so much, like, going for me, I write about these issues with so much authority, but then I have to keep my husband in the room just for me to be taken seriously. It's something else. Yeah. but but I would like to say this on record that even as a doctor, being a woman and getting care from this health system is really painful. So that has given me more empathy towards the way I treat female patients. Like, I mean, I take them 100% more seriously now than like back in the day, I guess.
So I also have this instance where I have autoimmune disorder. So once I had
Mm-hmm.
gone to see a doctor, and it was a new doctor that we were consulting, and my parents were with me. So I was right there, and I was about to tell the doctor, what is the problem, how it started, and he's like, "You please don't tell. Let your father tell it to me." So I am a 25-year-old person. Okay. So asking me to not talk and asking my father to talk instead of me, to tell him the problem that I am facing.
Mm-hmm.
Weird. I wanted to ask two more questions. So one question is what are some of the actionable things that women with PCOS can do? And
Mhm.
then later on, what are some institutional things that need to be done in order to fight PCOS? So you can take it in whichever order you want to.
Before I take these questions, I would like to say that I'm so sorry that that incident happened to you. Um, I mean, it should not have. And generally, no matter how close people are to us, it's not likely that they will know all the details of, how what we're going through and how we're feeling. So I'm really sorry that such an invalidating experience happened, and I really hope that you are able to find a provider who's able to give you more validating and collaborative experience. um, Saying this, I would like to go on to your first question, which are actionable steps. And these are really interesting but small things you can do. And the first thing is get enough sleep. Now, I know that everybody says PCOS is some, disease of the lazy, but that's not the case. And the second thing is, if you are stressed and your stress hormone is high, it's going to knock everything off of balance. So, it's one of the easiest things to do to get 8 hours of sleep. And it's the most rewarding thing also. Like, if you can just ensure that you have enough rest so that the level of stress hormone in your body comes down, right?
Hmm.
And the second thing you can do is, to reduce stress is again meditate or some form of mindfulness or 10 minutes of relaxation and calm. Now, the reason why I'm starting with this as the first actionable step is because not only is it easy to do, but it's also something that anybody with any other mental or physical constraints or any environmental constraints can be more easily accept. Like, if you say someone go to the gym, they will have a lot of inertia and a lot of mental barriers first about doing that. However, getting enough sleep is easy, drinking water is easy, and it's not shaming you in any way. And it also gives you this, like, if you start with a diet or exercise, then you're starting it from this whole perspective of shaming yourself कि मैं मोटी हूँ, मुझे पतला होना है, मुझे weight loss करना है. But when you start with something like drinking water and sleeping 8 hours and focusing on stress reduction, it takes on a nazariya of taking care of yourself,
Yeah.
which is from where I want you to start your PCOS management journey at all. Right now, once you are able to do that, then I would like you to eat more, not less. Now, what I mean by that is eat more protein, eat more vegetables, and eat more colorful, good things, and the bad things will go down by themselves. Because you won't be hungry enough कि आप if you eat at least 30 gram of protein with breakfast, 30 gram of protein with lunch and dinner, right? At least
Hmm.
your they say 1 gram of protein per kg. So if you're 60 kgs, then you have to have 60 grams of protein, right? And if you are able to accommodate that much protein, and trust me, I have, your stomach will not have the space to take in all the bad stuff. So, and restrictive diets again put all the focus on shaming, and which is not what we
Hmm.
want. We want to take this from a perspective of wellness. So I would say eat more of protein, 30 grams of protein per meal. Include as many vegetables as possible in, like, however deliciously you can cook them. And like, including fiber, and fiber also is very very important in two ways. One is fiber really helps in satiety, which is making you feel full. And fiber also helps in reducing your blood sugar. अगर आप एक चॉकलेट खा रहे हो और उसके साथ साथ एक फाइबर युक्त चीज जैसे खीरा खा रहे हो, तो चॉकलेट से जितना ब्लड शुगर पीक earlier हो सकता था, उससे एक blunted या कम peak होगा if you have it with fiber. So one of the things that I do is I put fiber powder in anything that I put sugar with. जैसे कॉफी में अगर मैं शुगर खा रही हूँ उसमें मैं फाइबर भी मिला लेती हूँ to blunt my blood sugar peaks, right? So it's not like you have to minimize sugar, but if you have to have sugar, for example, black coffee कौन पी सकता है without sugar? So then you can do this, right? And
Hmm.
including fiber in the form of apples, cucumbers, these are all like very edible, tasty
Yeah.
things. And if you can add peanut butter and then apple, it's tasty, but it's also got like protein and fiber, so plus plus. So what I would like you to prioritize is increase protein, increase fiber, all the other things will go down by themselves, right?
Hmm.
And reduce sugar, like मतलब processed food तो आप आसानी से cut out कर सकते हो. That is a very easy step to do. But you can also minimize sugar in everything else that you eat. But if you have to have sugar, you have to pair it with something that has fiber. It can be fiber powder, but it can be anything else, right? And then once you do these things, carbs and fats का consumption तो कम हो ही जाएगा. But if it's something like a party or अगर आपका birthday है and all, and if you want to indulge, I would say please indulge, because we're not punishing ourselves here and you will not stick to something that you hate, right? So that now let's go on to exercise. Exercise is a beautiful, liberating thing, and exercise is not a punishment for eating food. Exercise is a celebration of everything that your body can do. And like recently I had to climb like a lot of stairs, and initially I was like little bit pissed off. Then I saw like a couple of old people taking the lift, and I was like, you know what, किसी दिन मैं stairs climb नहीं कर पाऊंगी, but आज वो दिन नहीं है. I'm going to celebrate the fact that I'm able to do this, and I'm just going to take these stairs, right? And the best part of exercise, and especially this is what I need to really mention it, is that in PCOS there is one form of exercise which is magical, and that is strength training. And like if you see Indian women, they are okay with going on walks. वो लोग cycle भी कर लेंगे, and if they are adventurous, they might even swim. But nobody is going to go to the gym and start lifting weights because it just comes across as a very manly, masculine thing. But there is nothing more rewarding, especially for women, rather than strength training, because firstly it instant confidence boost, because this is something you thought was difficult. It's not difficult, and you're doing something that you thought was difficult, so there's that. The second thing is we need to build muscle, because muscle is what consumes glucose. As you exercise and do strength training, your muscle mass increases, and then your muscle also becomes more sensitive to insulin, which is our key problem with PCOS. So, when your muscle mass increases and a lot of your muscle becomes sensitive to insulin, then you are directly targeting the key issue in PCOS, right?
Hmm.
So, there is one that. The second thing is, as you grow older, it is your skeletal muscle mass that's going to determine your bone strength and how strong you're going to be, how mobile you're going to be. So if you start strength training now, by the time you're 70, 80, I guarantee you are not going to be wheelchair bound. You're going to be independent, and you are going to be doing whatever you want to do by yourself and not as a burden on anybody. Your bones are going to be strong. You're not going to develop osteoporosis, which is one of the reasons why if you see women are like older women
Hmm.
are hunched over, they have fractures, all of that. And having um, high muscle mass is an independent predictor of long life. You're going to live longer than um, what you would have if you hadn't done that, right? And on top of
Hmm.
that, your likelihood of developing any of these things like diabetes, hypertension, heart disease, cholesterol, all of that goes down. Now, if you see, I have not mentioned weight loss even once, because
Hmm.
this is rewarding even as, in many, many other ways that actually matter,
Hmm.
right? Like, if I had to suggest one change in your life that would, completely change the way that you live for the rest of your life, that's going to be strength training.
Hmm.
And
Yeah.
I understand that there is a lot of inertia, because अगर आप जिम का ad भी देखो, it will be all these bulked up masculine men with their whole like flexing and all that, and that kind of like pushes you away कि मैं जा सकती हूँ क्या. But like, if you overcome that and then go do it, like, it's very, very rewarding. And I don't know what else I can say, but like, if you look at any disease and then you look at the research on strength training, there will be some way in which strength training improves that disease. Any disease, just take any disease. So do strength training, and then if you have the will to do cardio, you can. Cardio is also quite good. American Heart Association suggests that you do 150 minutes of cardio per week. That would be like 30 minutes for 5 days, which is quite a bit for a lot of people. So I would suggest at least 3 days of strength training and 1 day of cardio if you can. Or you can add like 20 minutes of cardio to that strength training routine. But you can start very slowly. Even if you start 1 day strength training per week and add a little bit of cardio and then build it up, that's fine. Like, do as much as you can, but do it, right?
Yeah.
And the other thing would be walks, post meal walks. Again, very
Hmm.
easy. After you have food, just take a small walk, 10 minutes to 20 minutes. That will also modulate your blood sugar levels very well.
Hmm.
Yeah. Um,
Yeah.
and
And
do something that is um, fun for you. Start off with what is easy for you, but definitely include strength training at least once a week, but thrice a week is ideal. And do something that's fun, like if you enjoy dancing, if you enjoy swimming, something like that.
yeah. Also, so these are some of the measures that people can take personally.
Mhm.
Now you mentioned that there's no standardized guideline in terms of PCOS, either for food or for exercise. So if there were to be a standardized PCOS guideline about information, then the contradictory information would stop. So
Mhm.
like that, what are some of the institutional measures that should be taken in order to tackle PCOS? If you have some notes on that, some insights.
Mhm. So, for that, I need to tell you about how I got diagnosed with PCOS, right? So, when I was doing my post graduation in internal medicine, and this is supposed to be the most stressful period of any doctor's life, right? I had joined college in 2020, and at that time, I weighed 50 kgs. The next thing
Hmm.
I know was 1 year later, and my periods had completely stopped, and I did not have any idea why that happened, because I had no time to look in the mirror and notice that I have been eating unhealthily and all that, and I've suddenly put on weight. 1 year later, I checked my weight, I was 66 kg, right? 16 kgs weight gain within a year.
Hmm.
And
Hmm.
I would say that one of the main reasons was my residency, because residency is not just tough, it's mentally taxing. You're doing 24-hour duties like 2 3 times a week, and you're not able to sleep, you're not able to eat, all of that. And that kind of work pressure is again going to push people into these lifestyle illnesses, right? So if you see people working corporate jobs that require them to you know um, handle a lot of stress, and people that are working in jobs that require them to have like a messed up sleep cycle, you know those are all people who are likely to be to develop PCOS. While that is one thing, the second thing is ऐसा नहीं है कि जो होम मेकर्स है, जो काम नहीं करती है, या कोई स्टूडेंट्स है, they are not going to develop PCOS, because patriarchy and the way it operates itself puts undue stress on women. जैसे if you see a homemaker would be waking up 2 hours earlier than her husband to pack his breakfast, whatever it is. And even a working woman might come home and pick up a second shift in taking care of her children. So, all of those things will then eventually lead to um, worsening of PCOS as a condition.
Hmm.
So those are the basically, if you see a woman who sleeps 8 hours, they'll be called lazy by their family. And
Hmm.
it will be like a woman who takes care of herself or prioritizes herself, she will be called selfish by her family. Or a woman who wants to, जैसे अभी I have given you some advice for eating, right? If you were a married woman who's cooking for 3 4 people, would you be able to implement that for yourself? क्वाइट अनलाइकली. कोई भी घर पे अगर कोई माना नहीं और वो बोल रहा है नहीं नहीं मम्मी मुझे यही खाना है, और आपको तो टाइम नहीं है 2 तरह का खाना बनाने का, तो आप वही खाएंगे जो आप घर के लिए बना रहे हैं, राइट? तो देर इज अ लॉट ऑफ इंटर वीनिंग कल्चरल फैक्टर्स that are causing these issues. For example, I read an article which said that the some woman had gone to a doctor who suggested millets instead of rice. And she was like, if I have to eat millets every day for a month, it will take up 1/3 of my monthly salary. How am I going to afford this?
Hmm.
राइट? अगर आप देखोगे तो कैपिटलिज्म, पेट्रियार्की, the way corporate greed works, all of these oppressive systems like casteism could be a reason why a Dalit woman faces a lot of pressure in her life. So all these oppressive systems, the way they exist, they are going to intersectionally affect health, and PCOS somehow is always going to be affected by all these factors. It's a very complex thing we have to understand. The second thing is also microplastics. Microplastics are known as endocrine disrupting chemicals, which means that if microplastics are present in our everyday life, they're going to cause these disruptions in your hormones, right? So like that, not just microplastics, we have pesticides, we have so many pollutants that find its way in our food, that find its way in our everyday use objects, which we are ingesting every day. And that is also one of the reasons why women in India are found to have higher rates of PCOS, because we live in such bad toxic environments, right? Now, when I speak about all this, to you it might look like this problem is so big and complex and so interconnected कि you know, when you see the complexity and the enormity of some issue, you would be tempted to give up कि हाँ ये ठीक नहीं होगा, ये इतना बड़ा है, ये कहाँ से हम स्टार्ट करेंगे. However,
Hmm.
right? And if I say patriarchy also contributes to the pressures that lead to PCOS, then like it's not like we are not battling patriarchy for so many years, right? अभी मेरे बोलने से सडनली कोई ऐसा तो नहीं बोलेगा अरे वो PCOS कॉज करता है, अभी पेट्रियार्की को डिसमेंटल कर लेते हैं इमीडिएटली. ये तो नहीं होने वाला है. So, what I'm trying to say is anything that institutions, if schools are doing something for student wellness and employers are doing something for employee wellness, that is definitely going to have a positive effect. Just like how any negative thing that they are doing is having a negative effect on
Hmm.
PCOS. So, when we say ki, what should institutions do, then we want them to prioritize employee wellness, or we want them to prioritize student wellness with a gender lens, like maternity leaves, paid paternity leaves,
Hmm.
empowering women to take leadership roles, not also empowering men to go back home and help. All of these things definitely will help in PCOS also. Now, this other thing also I wanted to point out. I don't know if I'm going on a tangent, but with exercise, if you can find out something about the exercise gender gap, you'll see that in a married couple also, men get protected time to exercise, which means that their time that they say कि अभी मैं exercise करूंगा is protected. तुम कुछ भी करो वो नहीं करेगा, मतलब मना नहीं करेगा, वो करेगा. But a woman's time to exercise, she will try to pair it with, okay, I'm going grocery shopping, shall I also go for a walk? Because
Hmm.
they're not prioritizing it. And in fact, I see that in the, like, understanding that helped me prioritize exercise in my life in a way कि when my husband goes in the morning to the gym, right, and वो time is protected, तुम कुछ भी बोलो, he will not leave. So on the days that there's nobody else in the house, if we both go to the gym and the maid will come, and who will open the door for the maid bol ke, I used to stay back and not exercise that day. And then I'm like asking myself, why am I doing this? Like, my exercise is also important. And if the maid doesn't come and both of us don't have food, we'll arrange it somehow. उसका खाने के लिए मैं क्यों वेट कर रही हूँ, मतलब अपना एक्सरसाइज गिव अप कर रही हूँ. तो this is a small thing, but lots of women are giving up lots of time that they can be spending on self care and exercise and following good diets, catering to and pandering to their husbands and their families and their children and all that stuff.
Yeah,
No,
this
we are
is
doing.
yeah. So these are some really important points. First, how all the systems and the systematic injustices are interlinked, and second, how women are not prioritizing themselves. And essentially, it's about reimagining all these big structures from a very feminist perspective, from a very
Mhm,
social justice driven perspective.
mhm.
And
Yes,
only then we'll be able to address this issue. So, this is a symptom of the larger social disease that we are having.
yes, I would say that. So in the end, like, as a healthcare professional, I can only give actionable steps to reimagine the way and the relationship a healthcare professional who's addressing a patient with PCOS can have with them. And if that, so वो सिनेरियो से मैं बोलूंगी कि healthcare professionals who are who might have a patient with PCOS, if you are not aware of how to treat and what to suggest and what options you can give them, I would say कि I will explain to the patient about the disease and then ask them for some time, and you can definitely do your own reading up and you know update yourself on the research before you say anything. And
Hmm.
then I would also suggest that healthcare professionals would change the lens through which they view women's problems, and see them as how they would affect the woman rather than how the woman having it would affect the patriarchal society. तो आई वुड सजेस्ट कि आपका नजरिया ऐसा बदलना चाहिए कि यू वांट योर पेशेंट टू हैव अ वेरी कंफर्टेबल एंड अ वेरी productive life, rather than how they can be fitting this image of a perfect woman according to patriarchal standards. And the third thing I would suggest is कि आप थोड़ा कोलैबोरेटिव बनो अपना पेशेंट्स के साथ, उनके साथ अच्छे से बात करो, पता करो कि क्या आपका ट्रीटमेंट में काम कर रहा है, क्या आपका ट्रीटमेंट में काम नहीं कर रहा है, उनका सजेशंस भी लेके हम एक ऐसा ट्रीटमेंट प्लान उनके लिए बनाएंगे जो उनके लिए ना सिर्फ एक्सेप्टेबल हो, बट दैट दे कैन कंसिस्टेंटली फॉलो एवरी डे, right?
Yeah.
So that is what I would suggest healthcare professionals. And what I would suggest patients or women with PCOS who have been gaslit by the medical system: advocate for yourself. Like, no, I don't know if anybody else has validated you, but I am validating you right now by saying that as a doctor also I have suffered in this system, so the system sucks. right? It's not in your head. Your doctor, if you think your doctor is gaslighting you, they are probably gaslighting you. Okay. So you have blanket validation from someone from inside the system कि ये हो रहा है, तो please stop doubting yourself and then advocate for yourself. Take somebody who can advocate for you if you would be comfortable with that. Please do your own reading up. And just because you are googling or finding out information about your condition doesn't make you an annoying patient. It makes you a well informed patient. And also understand that the questions that you ask your doctors, they are obligated to answer it. You're not annoying them by asking questions. It's your body, right? No doctor is an authority on your body. And
Yeah, please complete.
yeah, and please find yourself like a good professional that you can find a collaborative care plan with. I know older people are a little bit more stuck in the biases, but a lot of new younger physicians are unlearning all that, and then they might be able to give you the help that you need.
Uh, Thank you so much, Christianez, for joining us today and talking about this issue from such a beautiful lens. You shifted the entire narrative, from, the narrative is always blaming women, that it is
Mhm,
you are not doing enough, and never from the perspective of that you need to take care of yourself. We understand that, the life that you are leading, there are so many structures that are against you, but you need
mhm,
to take care of yourself. So nobody is talking to women from that perspective, and I'm
mhm.
so glad ki you did that today. Thank you so much for joining us today. I think we'll link your article in the YouTube video so that people
Mhm.
can read that, and can understand it further. And yeah, thank you so much again for joining today.
Thank you so much for inviting me and allowing me to talk about something that I've gone through personally and something that affects a lot of women. And I really hope that we can have more of these conversations and that eventually, seeking healthcare for PCOS is not the painful journey that it is now. I really hope it gets better for all of us.
Yes. Here's to reimagining a world where women prioritize their health, and we do not have the, problems like PCOS anymore.
Uh, yes, to that.